Hello and welcome again to HRSCO Online, your online resource for custom foot orthotics, custom shoes and orthopedic devices. In this section we're going to take a look at partial foot amputees. This is part one video of a two-part series where we look at the requirements and the care for this very particular patient population. The most important thing that we can do as practitioners is to help these patients get back on their feet and remain healthy and active for as long as possible. In this regard, our most important line of defense is to give patients comfortable, well-fitting shoes. This was recognized by Medicare in the 1990s with the introduction of the therapeutic shoe bill. Sometimes, despite everyone's best efforts, we end up with a patient who has a blister or an ulcer and they've had to face an amputation. In those cases, we'll make a custom foot orthotic for the patient and we'll apply a toe filler, usually at least the hallux and possibly some of the lesser digits as well. Typically, we would not recommend making toe fillers for patients who've just lost some of the lesser digits. If we can provide a filler for that patient, we will seat them better in the shoe. The custom insole will provide total contact for the plantar surface of the foot, reducing areas of pressure and potentially reducing the possibility of further amputations. If the cycle progresses, we get further amputations and we can end up in a situation where a patient becomes a transmetatarsal amputee. Now we have a larger filler to take up more room inside of the shoe. Unfortunately, this is a downward trajectory for the patient, and very often they'll end up becoming a BK amputee. If you have to cast a patient for a custom foot orthotic and they are an amputee at some level, we recommend using impression foam. In those cases, we're not so interested in correcting the function of the foot, although we will provide some arch support and a deep heel cup to provide control of the rear foot. However, we are more concerned with the position of the remaining digits in relation to the foot, and we also want to make the orthotic to fit inside the shoe. A well-taken, semi-weight bearing impression foam cast is sufficient, and we always recommend that you send the shoe along with the cast to the lab. In that case, the filler can be made with an intimate fit and you will not have to adjust it when you're trying to dispense it to the patient. For more information on treating partial foot amputees, please go to our website, hrsco.com, and click on the Education tab. Thank you once again for joining HRSCO Online.